My name is Taylor Erfling. It is March 23rd, 2017, and it is about 12:35 in the afternoon right now. I'm going to be showing you how to administer an enema. First, before I begin the procedure, I'm going to assess my client. I'm going to see when they last had their bowel movement and the size, color, and consistency of that bowel movement. I'm also going to assess if they can ambulate to the bathroom, if they need a commode, or if they have to remain in bed and use a bedpan. After I have assessed everything, I'm going to assemble my equipment. So I have a bath blanket, some water-soluble lubricant, clean gloves, enema, and tubing, paper towel, and also warm water. Now I'm going to prepare the procedure before I enter the room of the client. I am going to take my enema bag. I am going to close the clamp of it, and I am going to fill it with 500 to 1,000 milliliters of warm water. I'm going to hang it up on the IV, and then above a trash can or a sink, I'm going to release the clamp and prime the tubing, and then I'm going to re-clamp it, and then I'm going to set it up here until I'm ready for the procedure. Okay. Then I'm going to enter the patient's room. I'm going to identify myself. Hello, my name is Taylor. I'm going to be your nurse today. I'm going to identify the patient with 2 identifiers, name and date of birth. And then I'm going to explain the procedure to them, that they're getting an enema, what it entails, and why it's being done in order to stimulate their bowel movements. After I've done that, I'm going to provide privacy. This is a private room. The door is closed, so privacy has been provided. I'm going to wash my hands, and I'm going to don my gloves. Okay. Next, I'm going to assist my client into the left lateral position. I'm going to ask them to help me in any way that they can, depending on their level of mobility. So what I'm going to do now, I'm just going to turn on the count of 3. 1, 2, 3. I'm going to bend their right knee as much as possible. There we go. And then I'm going to cover them up with a bath blanket so they don't get cold and so that they don't feel overexposed. Okay. I am also going to make sure that there is a waterproof pad underneath, and in this case it is already provided. Next, I am going to bring my lubricant over, and I'm going to lubricate the tip of the tubing. There we go. I'm going to raise the left buttock, and I'm going to insert the tubing 3 to 4 inches. I'm going to be monitoring the client every step of the way, making sure that nothing is causing extreme discomfort or pain. After I have it inserted, I'm going to remove the IV bag from the top, making sure not to spill it. I'm going to lower it down to the level of their hips, and then I'm going to release the clamp. There we go. And then I am going to slowly raise the bag until it's about 12 to 18 inches above the patient's hips. Now, if they are experiencing any discomfort or feeling of fullness, any pain, I am going to take this IV bag and I'm going to lower it back down. And if it's still discomforted, then I'm going to clamp it, wait 30 seconds, and then begin it again at a slower rate. Don't raise it as high next time to allow it to be more comfortable for the patient. In this case, everything's going well. Once the enema has been fully administered, I'm going to clamp it again, and then I'm going to get a paper towel, and I'm going to slowly pull out that tubing and wrap it with my hand in the paper towel, and then I'm going to dispose of this. I'm also going to, if I had a disposable pad at this time, I would take that out and discard it. I'm going to remove my gloves. I'm going to ask the patient to hold the enema for 5 to 15 minutes. And then I'm going to place their call light in reach, or I'm going to wait in the room with them, one or the other. And then afterwards, I'm going to assist them to defecate. In this case, my patient is ambulatory, so I help them to the bathroom. Afterwards, I'm going to document all of my results, and that's how you administer an enema. Thank you.